It is time now for medical rounds, and we've certainly been experiencing some dangerous cold weather this week. And as kids are outside waiting for the buses and people are spending time outside walking their dogs or maybe doing other physical activities, it is important to think about safety in these bitter temperatures. Joining us this afternoon with some safety tips and signs to look out for is Dr. Lin Monte with the Backus Hospital Emergency Department to talk about an increased risk of hypothermia and frostbite and what this really means and what it brings to us. Thank you, doctor, for being with us.
Oh, my pleasure.
Yeah, talk to us a little bit about the increased risk of hypothermia. Have you seen a lot of people coming into the ER during these really cold snaps?
So not quite just yet. I really feel like the cold weather just really kicked in this past week. It's otherwise been kind of seasonally cold, as was mentioned earlier, but with like the single digits in the teens recently, this is a perfect time for this news clip. Temperatures this low can result in frostbite to exposed skin in just minutes, like under 30 minutes. So these frigid tempers should really be taken seriously. And it's important to dress in multiple layers when you go outside. That includes hats or earmuffs to protect the ears. Thanks to COVID, with the mask mandates, protecting the nose helps to protect your nose, and it protects your lungs from inhaling the cold air. And also mittens rather than gloves to help protect your fingers.
Okay, so how dangerous is frostbite and what are the signs?
So frostbite is most common on the fingers, the nose, the toes, the ears, and the cheeks. So basically all the small body parts that are exposed to the cold air. Important signs to look out for frostbite are cold skin with like a prickly burning like sensation. You may also feel like numbness to your extremities. The skin will typically turn like red initially, and then it'll look like a waxy white. Then it progresses to like a bluish purple color. And then in the later stages with prolonged exposure to the cold, it can turn like a brownish blackish color with signs of tissue death. You may notice you're more clumsy due to muscle and joint stiffness. Blistering can occur like 1 to 2 days after rewarming. So it can get pretty bad if you're not protected.
All right, so definitely want to see a doctor if that happens.
Yeah, important to, I'm sorry?
We're out of time now, but we definitely want to, if you have those signs, make sure you're checking in with your doctor.
For sure, yes.
Oh, thank you, doctor. And for more information, it's a good warning sign out there. Don't, take it seriously if you start noticing those changes in you or your kids. But you can find more information at backushospital.org.